colleagues actually who can lead around the sort of ageing themes. But it took me a while to work out how to get into this room, so maybe they're taking a bit of a while to work out how to get in there.
Yes, Abs and I were just saying that it's a while since people have taken themselves into another room. They'll all have forgotten what to do. I think Graham could have done to just give everyone a reminder.
I would have thought Alison Abs was quite used to taking himself into another room, being an office. I mean, I would have thought when he's watching them play, he quite often thinks, "Oh, I can't watch this anymore," and takes himself off. Is that right, Abs?
Very right, Tony. You're definitely right. Well, you did see my voice play yesterday, so.
We've seen every room in your house, Abs, haven't we? As time's gone by. And you're walking up the stairs and Lightning McQueen behind you and all sorts of stuff.
Yeah, but luckily now the kids are back in school, so I'm happy to just stay somewhere now than running around the house.
I've just downloaded the Track and Trace app. Has anybody else done that?
I just did that this morning.
Yeah.
I'm still like, what is this? Because
I know.
you're saying my area is really, it's got like high concentration of COVID. So I'm like, oh, should I take the kids back in or what's this? But I still don't know what exactly to do with it. But I did it this morning as well.
Yeah, no, I'm not entirely sure what you're supposed to do with it either. I've only done it on my work phone as well. It didn't feel right doing it on my personal phone. So, yeah, it's all a bit weird, isn't it?
So what does it do, the Track and Trace app?
I think literally it just traces where you are. So like coming into work today, you have to take a picture of the app, of the code thing, and then it logs it that I've been here in our office.
Right.
And then I think, well, I'm making this up. I think this is what it is. I think if somebody else tests positive who's been here, then I'll get an alert about it. I think that's how it works, isn't it?
I think so.
Yeah, I think so as well.
But I'm not sure. Like if you go to a restaurant or a bar or whatever, and you do it there, and one person is positive, they must do it to the time you're there, because it couldn't just be anybody, because otherwise you'd never go out. We'd all get calls, wouldn't we? So
yeah.
Yeah, I'm not sure. Let me just. I know people were. I'm just going to see where Hannah is. The other Hannah. How's everybody found this morning?
Really good. Really.
Yeah. Really interesting. Yeah, really.
I went on one of the system leadership conference things that they hold as well. It really is good. Finding fantastic speakers. Really good speakers, aren't they? Really good.
Yeah, I think it's I think it's that support to keep thinking and feeling that you've got the permission to think this way and think in this really different way is really important, isn't it? Because you could do one training and then you go back to your normal day job, don't you? But there's something around having that volume of us all thinking in this way and being able to work in that way. I thought the permissions, I sit on PEG, so I've heard Thea talk before about permissions, but that's really important, that people feel that they're just able to get on and do the right stuff, isn't it?
Yeah.
Yeah, I really, really enjoyed Thea's presentation. And like you say, Hannah, I think the thing about the permissions is good. And I just raised it in one of our meetings the other day, and this might resonate with Tony a bit, but it's great if your people at the top are saying, yes, you've got permissions, as long as it's not illegal and it doesn't cost a load of money and so on. But it's sometimes the managers further down that then withdraw those permissions. So it's those sort of people in the middle who are scared for lots of different reasons, who then take those permissions away.
I thought she was actually quoting Kath Roth actually at the time. So it did sound like it, didn't it? I mean, I agree with that, Alison. I mean, the thing is, when we did it in social care and all the strength-based changes, we actually had a lot of discussions with the frontline workers and the managers, and that's what resulted in, not just that change of kind of focus, but the practical changes as well. The reduction from 30-page prescriptive sessions to 2 or 3 pages. I think it's, you know, not being cynical, but it can't just be lip service, can it? It needs to be accompanied by something tangible for staff. And I think you're right, Alison. I think there are times when maybe middle managers, you know, absolutely buy into it, but if nothing operationally happens to make, you know, to enable them to make those changes, it can seem a bit like lip service at times, can't it? So absolutely kind of.
And I think as well, when those changes perhaps put people's services or people's job roles at risk, and actually the thinking means that your job isn't needed anymore, you know, suddenly people put the barriers up, don't they? Then they're not going to run with it if it means I'm out of a job, or my organisation actually isn't required anymore. And that's sometimes when that sort of thinking gets thrown to one side, doesn't it? And protectionism comes in.
Yeah, it does.
Completely.
Yeah, and I think that's where those person-centered out. If you're all working to the same person-centered outcomes, then that really helps, doesn't it? And there's something there about developing those shared outcomes rather than, like you say, the individual organisational ones.
For me though, I've been development manager since about 2014 with housing for older peoples, and moving what you know as the warden service and things like that. And there is a massive thought with sort of the team leaders and the frontline staff that, you know, the changes, you're risking the job or anything. So it is about open honesty and getting a buy-in from people as well, giving them the facts and the figures of where you're heading or what you're doing, and not doing things behind the back, involving them. That was a really big thing for us. Yeah, no, absolutely. I mean, I don't know where Hannah and Carol are, who are the other people sort of leading this workshop, but I mean, the big message that we have in our work from Health Watch and the People's Voices group, which I chair, is about we need to do all this in partnership with people, and that feels like that's been a strong theme of the morning, actually, in terms of co-designing and asking people what matters to them. But the other key bit is the frontline workers doing it in partnership with them, isn't it? And often the frontline workers know how health and care services could be improved. We just sort of need to listen to them as much as we need to listen to patients, citizens, the public. But it's often said that that's that middle management that not intentionally, I don't think, but for whatever reason, the sort of system change stuff doesn't happen. And you know, I think in the health and care system, we probably need to move into focusing on that a bit more, don't we? So this particular workshop. So thank you to those that have come to this. It was focusing on sort of aging well, and the idea was to sort of just give the headlines of the pieces of work that are going on in the city around reducing isolation and the work that we're doing in co-design. But I think Hannah McGurk was going to lead it, but particularly wanted to sort of hear from yourself around, I suppose, how you were finding putting people's voices at the centre of your work, the experiences that you've had, just so that we could share those, really. And I suppose from my perspective in Health Watch, I'm really interested to understand around how you're approaching it within your local care partnership around older people, particularly during winter, and the threat of isolation, and that, you know, that will have potentially on a lot of our older people communities in our local care areas. So I don't know if anybody wants to share around some of that.
So I'll kick off, Hannah.
Thanks, Tony.
So I haven't got a particular local perspective, so apologies. But was you there last night, Hannah, at the Social Care Equality Forum?
No, I couldn't make it. Tatum came to that.
Yeah, so that was an interesting thing, because I guess from a citywide perspective, one of the things we're trying to do is, in terms of engaging people's voices, is kind of have some kind of interface between the primary care networks and the local care partnerships, because, you know, everything kind of fits together at some level, doesn't it? And, you know, many of you will probably be aware that the patient participation groups generally don't reflect the demography of the communities that they sit within. They tend to be quite homogenous in the sense of, white middle class, retired professionals, etc. Not really much kind of membership from the BAME communities, etc. So myself and Adam Stewart and a couple of colleagues did a presentation to the Leeds City Council Social Care Equality Forum yesterday evening, which brings together a whole range of leaders from the BAME community and other minorities, just really to try and kind of enthuse people, but more so really say why is it do we think, what are the barriers to people joining these groups? And it was a very interesting evening. I guess the reason I mention it is kind of in the broader context of how difficult it can be to hear everybody's voices, from all communities, and as local care partnerships covering 50,000 people, within that 50,000 people, there will be many. In many of the LCPs, there'll be many diverse communities, and it's how do you hear the voices of the minorities. And I think very briefly, the only other thing I'd say, Hannah, is I've been quite mindful recently, because I know local care partnerships are trying to achieve an awful lot at once. The kind of build the relationships. There's the population health management program, and kind of related to that is the asset mapping exercises. If I'm honest with you, I think the population health management is a bit of a double-edged sword, because it is very much focused on one cohort of people in terms of frailty. And I know we have to start small, but the numbers are very, very small that we're going to be working with. So I think there's a lot of work to be done there. But what I did want to say in terms of the context of this discussion is that I do feel at times that a lot of the asset mapping is still being done from the perspective of professionals and organisations, and I include kind of the voluntary sector within that, which is all well and good, because there's a lot of knowledge there, but I think it kind of misses that additional grassroots layer of assets, people coming together much more formally. And I think one of the issues is that under a population health management approach with a particular cohort, you may well map your assets, and you may well identify gaps in services, for want of a better word. But then when you speak to the people, we need to be asking, yes, because they may well agree with us that there are gaps in those services, but actually they might not say, they said, but that's not a priority for us. We'd rather you focus your priorities on this. So I guess my main point really is, in terms of listening to people's voices, I really would like to find a way that they are involved in the asset mapping, so we can hear much more about the grassroots, the things that as professionals we just won't even think of or know about. I think one of the ways of doing that, Hannah, is through the community builders. The ABCD community builders, very keen they get more involved with the LCPs. But as I say, secondary to that, ensure, okay, we have identified these potential gaps in assets, but is this where you want to focus? Is this as people of that community, do you think this is where we should be focusing our attention? So it's kind of twofold, and that kind of ties in a little bit to the permissions as well, doesn't it? Because perhaps the LCPs need those permissions. Yes, we're being told we need to be working with people living with frailty, but the more we speak to people, actually they say this is much more important to them locally, and how we kind of strike that balance, I guess, really. So I think that's where I'm at, Hannah, personally.
Yeah, no, I think I completely agree with that, Tony, and that's some of the messages we've been feeding in, sort of to Kim at the local care partnership development team, around how can we support local care partnerships to really put those voices sort of into health and care decision making at a local care partnership. So we are one of the things that we'd like to support with is, for each local care partnership, we're offering that there is a people's voice group sort of rep to support that thinking, to absolutely support, what are the different mechanisms that we can all try to make sure we are hearing those voices of inequalities, because completely echo, that's our experience with patient reference groups, is that they aren't representative of local communities in terms of, especially in terms if we're seeking to improve the health of the poorest fastest. Those are the voices that we need to, and I think there's lots of lots of really creative ways we can do that as well. So we're really keen from a People's Voices group to support that. So local care partnerships should hopefully see some of our People's Voices group advisors starting to be part of that. So
that would be great, Hannah. I mean, last night there was even suggestions that there was separate BAME PPGs set up. Now, obviously, we wouldn't ideally want to do that, would we? Because we'd want it to be much more connected up and inclusive, really. But that said, if you've got representatives from the minority groups turning up to this very homogenous PPG and they just don't feel they can get their voice, their voice heard, then it might be that is something that could potentially be trialled, isn't it? And then if that PPG reflects the community, is informing GP practices that are looking more outwardly and thinking more about wider determinants, that can only be a good thing, can't it? So, but it's every time you go to a forum, you think how challenging this is, don't you, really?
Yeah, and it'd be good to link it all up, because I think this year what we're thinking was this was before COVID, was to try lots of different ways of doing that. So something called the Poverty Truth Commission we're going to do on the York Road, and so it'd be good to sort of just join it up now, wouldn't it? Because I don't think there is an easy answer to it, but we are committed to making sure that we are supporting local care partnerships with this, so that would be great. I'll just welcome Hannah. I didn't know where you were, Hannah. I thought I was in the wrong room. So we just started talking about the People's Voices element of the, and that's been a strong theme of the workshop this morning anyway, I think. But I don't know if, because this is only supposed to be a half-hour one, isn't it? So I don't know if you want to come in and talk about from your perspective, and Carol as well. I think Carol's here as well, isn't she? Hi, Carol.
I am here. Hi.
Yeah.
Sorry, we had a bit of an issue. We couldn't find any of the breakout rooms, so we're all trapped for a while. Yeah, I think Carol and I were just gonna talk a little bit about what aging well and kind of age-friendly leads means to us, and kind of the work that's going on, and if there was any questions or kind of how it fits in with the frailty stuff as well. So my role in particular is around frailty, and I'm just quite passionate about it being more than just medical, and how we work, kind of like what you've been saying, working with people and what matters to them rather than just what the data tells us we need to focus on, and how we have a more holistic approach to that. But I think it ties in really well with Carol's work around Leeds being an age-friendly city, and actually some of those wider determinants as well, and how actually we do need to work together, and it kind of all impacts in different ways. Carol, do you want to talk a bit about age-friendly Leeds?
I can, yeah. I mean, some of you probably know we've got quite a big age-friendly Leeds programme of work going on with a board led by Councillor Charlwood. So it's looking much wider than health and social care at housing and transport and planning and outdoor spaces. Looking at putting sort of an age-friendly lens on things, and looking at how services and activities and the physical environment sort of work for older people. And we've been doing a lot of work recently around ageism, and we have a whole Age Proud Leeds programme of work going on at the moment, which is all about tackling ageism, which is almost kind of the last ism that people still seem to get away with quite a lot. And it does, and ageist attitudes do have a big impact on people in terms of their mental and physical health. So we're doing quite a lot right now on ageism, and we've also got a programme of age-friendly ambassadors, which is something anyone can sign up to be an ambassador. It's not about being an older person, it's been about someone who wants to champion older people's issues. So those are just some of the things we're working on at the moment. And there's also Leeds Older People's Forum's Time to Shine team have put together a guide for age-friendly and dementia-friendly businesses and organisations. So if you haven't seen that, we can share that as well. So that's just a bit of what's going on at the moment. Is that okay?
Was there anything anyone wanted to ask about aging well in Leeds, or age friendly, or anything like that, either in terms of the frailty population health management or broader LCP work? Have you guys in your LCPs, have you done much kind of co-production or engagement with people and asking people what matters to them? Has that been part of your process yet?
In the Otlian area, we did a questionnaire and a survey to sort of say what matters to you, and the reality coming back was, you know, local communities, local areas being able to go out, transport. I think to be honest, I've been sort of involved in a lot of your age-friendly work as well, Carol, and yourself. There was nothing surprising coming out of that, and I think it doesn't even matter where we go across Leeds, really. There's still quite a lot of common themes that people still want to get out and about, be independent and have good communities to do that. And I think that is very much the work that you've just touched on, Carol, about having it age friendly. It's about the communities and the areas that people live as well. And I think that was quite clear from the consultation we did.
Yes, yeah, and I think because we have a partnership with the Centre for Ageing Better, which are a national organisation, and I mean the priority areas of work they're helping us with are housing and transport, and they've also done some evaluation on how the neighbourhood networks have been coping in the COVID. So yeah, I think like you say, people want to be able to get to where they want to go, live safely in their own home and their own community, and do what they want to do. Yeah.
Can I just say on that, Carol? I think it feels though in a time of COVID and with winter coming that there's a real urgency to think either locally within local care partnerships or as a city about how we enable people not to be isolated and lonely during this time, because of the huge significant impact that that's potentially going to have on people's mental health and physical health as well. And I suppose from a Health Watch perspective, we're really keen that there's an urgency to this conversation in terms of how we are all assured that within our local communities that there are places for older people to get out and about, whether it's on Zoom or whatever it is, or whether it's contact going in, or that feels like it would be a really significant priority for us as a city and a health and care system at the moment, and I think local care partnerships have a key role in that. And we're talking before about population health management, which sometimes feels a bit data driven, but I think we all know that if we don't act to enable older people to be less isolated during winter, then we're not only storing up huge quality of life issues for them, but for the health and care system itself.
Yeah, can I come in? Yeah. Can I come in, Carol, on that?
Yeah.
So with the outbreak of COVID, our initial reaction as a service, Housing Leeds, looking after our retirement life sheltered 4,000 properties, was to all run home, lock ourselves in the room, and to take on board telephone contacts instead of face-to-face. And we did that as a response to work from home where you can, blah, blah, blah. And as the months went on, we realised the significant impact on people's health and well-being. So we have started taking up doorstep visits again. So it's about contacting people. Are you safe? Is it safe for us to come? And, they put a chair in the hall and we go stand at the door at a good distance, still having that interaction and contact. And I think we need to take on board the risks of COVID, but work in parameters of what we can do within that rather than running away from that. I mean, we're back on site at Wharfdale and I've been for about 4 or 5 weeks now up at Wharfdale View, because there's a significant need to have that presence for people. Even though there's an extra care team on site, they don't look after everybody because not everybody has a care package. And people really felt bereft that they'd been abandoned. And I think not just from a housing perspective, from every perspective, you can't get in a GPs, you can't get to see anybody, you can't do this. And I think everybody really needs to think about how we can work safely to still support people without thinking it can all just be done over a phone.
Yes, yeah, because I think that, I mean, the whole impact of being isolated on your health and your physical and your mental health is it has to be balanced against the COVID risk, doesn't it? And I think there has been quite a kickback from older people's organisations as well, feeling that there have been victimized through COVID and targeted. You know, the whole, you know, all older people have been lumped as one. You're in the priority. You're more at risk than anyone else. And there's been some kickback from older people's organisations that they feel that's been an almost ageist approach to it. But yeah, I mean, there is a winter group which my colleague Rachel Brighton's involved in from older people's point of view, looking at how we go forward in winter. But I think, yeah, that there's nothing more valuable than that face-to-face contact.
Absolutely.
Yeah.
You're on mute, Hannah.
Sorry, had to be me. I think I totally echo that, and I think the information that we gathered during COVID, we've been doing regular engagement with people to get a feel of how it feels for people. And you know, there's a lot of confusion about what GP services and what health services people can access and how it will feel for them when they go back into services. So I think the more you know, and I think that's what we're talking about here. It's about person-centered sort of health and care services, isn't it? It's understanding how does it feel to be an older person living within particular communities within Leeds, and taking that sort of targeted approach to collectively thinking about, you know, how do we make sure that we know that people are okay, and you know that they're able to get out and about. And I'm also part of a group around the citywide ambition about encouraging people to be active. So, you know, just sitting there in your chair all day as an older person, you know, everybody knows this on that call, but that's not good for anybody's mental health or physical health. So I'm really interested to think about, you know, what's out there at you know, how are we enabling older people to get out and about or be active during this winter period? So I saw in the chat that Tony mentioned part of the LCP winter planning sessions, and that would be great if it, you know, it's great to hear that is part of the winter planning. And I suppose for me, it sits alongside the population. The population health management starts with quite a clinical sort of medical approach, doesn't it? And I think this sits alongside it, around us knowing who our vulnerable communities are at the moment and how do we support them during winter.
Yeah. So, and I think it is at a local level, isn't it? It's the LCPs, it's the neighbourhood networks as well. It's all the small groups that the Time to Shine programme is the funding, which has hopefully been extended for a further year. It is all at the work at that local level to support local people that's so important. But I suspect it's a challenge, isn't it, going through winter? I think a lot of people have lost confidence to go out, and to get people to go out again without getting them to continue to go out, I think is a challenge. And not just in Leeds, I'm on the UK. There's the UK network of age-friendly communities, and I hear from colleagues in other cities and other communities that we're all facing the same challenges about how we can keep older people active and connected through the winter time. I wish I had all the answers.
I think we've got Tony and Francis who wants to come in.
Yeah, mine's very, very brief. Just to kind of agree what you were saying, Hannah, and kind of I know Francis is going to follow on from me. I think just in terms of the population health management, as you rightly say, it's quite interesting when you hear the local care partnerships, the ones that are talking about social vulnerability, isn't it, in terms of part of their cohort, and that. I'm sure Francis would know what I'm saying here, because there is, I think, quite a variation in how social vulnerability is recorded, you know, in terms of, and therefore how the numbers are captured from that data. So yeah, it was really just to say it's one of the big benefits of the LCPs is to use that local knowledge on individuals that, you know, the neighbourhood networks, etc., have as well, because I think there is a bit of a disparity between how social vulnerability is recorded across primary healthcare and how it therefore comes out in that initial EFI data. I don't know if Francis, you'd agree with me on that, but it's about the data being the starting point, isn't it, and then capturing all that kind of local knowledge for individuals as well, because just because you've had a social services referral, which is one of the social vulnerability read codes, isn't it? It may well be that that's largely been addressed and you've got a very good community and family network in place. So yeah, I mean, it's obviously very important to use those local knowledges, neighbourhood networks, etc.
Francis?
Yeah, no, I would agree with all of that. Absolutely. I mean, I think, yeah, mental health is a big problem at the moment, isn't it? I mean, I think just purely anecdotally from what I'm doing day to day, I mean, I work in Collingham. There's loads and loads of people who are having significant mental health problems that have never had them before. I think what's happened this year has put a lot of strain. It's a sort of particular set of psychological circumstances, isn't it, that we're just not really familiar with. And a lot of people, who are normally very well, who normally do not suffer in that way at all, have had certain pressures applied to them, and they've not reacted that well to it. And a lot of it's to do with just complete isolation from family and so on. And so I don't know. I mean, I think that's a big conversation. Yeah, and if we're talking about that, the winter planning, that is definitely something Alison, I suppose, that's something that that would really be worth focusing on, and how we would deal with that locally in Wetherby, certainly. But yeah, I don't know if anyone's got any thoughts, sort of further thoughts on how. Yeah, I think I totally agree about staying active and so on. But if anyone's got any other thoughts on, the best services to access on for helping people, in this scenario, it's difficult, really.
My experience up to now is that's the whole point. All services locked themselves behind the door, so everybody was just doing telephone calls. And I think I'm not blaming anybody here, but I think more or less all services did that in line with the work from home concept and everything else like that. So everybody did that, and to some degree, we all thought we were doing a great job doing telephone calls, doing whatever. But I think the evidence is, I've seen it face to face. Wharfdale View's an extra care scheme in Yeadon, and the housing team worked from home, and we contacted people where we could, and we were doing what we could on a daily basis still. But that physical contact and that well-being for people, and people's health and well-being, like you just said, taking themselves back to bed because there's nothing else to do, didn't go out, they felt isolated, and then when they could go out, there was nowhere that they wanted to go because they didn't feel safe, and it's been massive. And seeing that physical change in people, it's quite heart-wrenching, really. People's health, and we've lost more people as well, not due to COVID, but their own health and well-being deteriorated so much that I just think a lot of people attitude was, I'm getting old, it's my last years in my life, why do I want to waste them stuck in and not seeing my family or anything? So I think there's a massive health and well-being significant from COVID, not just mental either. I think it's a physical impact on people.
Yeah, I mean, I was just going to sort of echo everything, and I would agree with what Francis was saying. This isn't people necessarily that might be on the data, might not have ticked those indicators that you were talking about before, Tony, in terms of social care support. I know from my mum's own example, she's seeing me and my children, she goes to a walking group, she's got friends, and yet still the impact, there are days when she looks more fragile than I've ever seen her look. There is something around this experience that is just, hugely impactful for everybody, but particularly for older people. And I suppose if the other thing in terms of vulnerable groups, because I'm a little bit sort of qualitative rather than quantitative, but is the impact on carers as well. That's another group that we're hearing significant impact on, and I'm really interested, or I think we should all be interested around how are we going to stop carers falling over during winter as well. So I don't know if that's within the winter planning as well, Tony, but that sort of targeted response to supporting carers to get through the winter. Just in terms of Francis's question around what support is there that people can be linked into, I think there's the local support, isn't there? So there should be like neighbourhood networks or local community groups. But I do think it's, the question around, what is there in terms of, the citywide approach to enabling some of that to happen as well, like, being active in your chair. And Hannah, I'm sure there's work going on in public health, isn't there, around activity-based chair sort of exercise and stuff. But I don't know if everybody's aware of all those sorts of different. It feels like it needs a coherent offer to enable people to be active and connect. I'm not sure, I'm not close to it, but I don't know if there is a coherent offer or not.
I think the offer's quite good. I think the problem is your barriers again, that people who need it most haven't got the IT equipment, nobody can get in there to show it them and to support them, and they're the cohorts of people that are probably most vulnerable for us.
Yeah, and if the offer is clear, then does everybody know who's having contact with older people around it as well? That's often sort of where it breaks down in terms of offering, do are GPs aware of that offer? And if they are, that's good, isn't it? But I think those are some of the questions that we sort of need to be asking ourselves. Tony, did you have your hand up?
I don't think so, Hannah.
Oh, sorry.
Although what I would say, seeing you brought me in, is I think the digital inclusion stuff's all very interesting, isn't it? Because I agree with everything that Sue and people have said about it. It would be kind of nice, wouldn't it, with the digital inclusion, if that was a way for people to talk to each other as well. A lot of time you hear about digital inclusion, it is about still being in touch with their services or, very valuable services. But if there was some way to, if you had somebody who was living 3 doors away from somebody else and they both had Zoom or an iPad and could actually talk to each other in a much more kind of relational way, that'd be great, wouldn't it? Because you don't want it just to be a service, do you? You're going to be contacted at 11 o'clock for touch base, see how you are. So I don't know whether the digital inclusion kind of has that aspect of trying to put people together.
I think it does. I think 100%. I think 100% digital take that whole person sort of. It's a skill that we can all use in lots of different ways in our life, not just about service provision.
Sure, that's good.
Just to say on digital inclusion, we did a report quite early on into COVID around the potential impact of digital exclusion and the factors that need to be considered when thinking about delivering services in a non-face-to-face way. But we are doing an ongoing listening campaign. So for the next year, we want to hear about people's experiences. So, if you're hearing particular insight and they're able to share it with us at Healthwatch, that would be great. Hannah and Carol, Hannah, is there anything you wanted to say?
I was just going to say about the physical activity thing. I know that Active Leads are quite involved with this wave, and I know there's a couple of LCPs are doing falls prevention and mobility stuff, and I know they're trying to work on how to get that offer out there a bit better. But there is, particularly in COVID, I think there's been a new physical activity booklet that's been circulated. So if people don't know about that, we could share that. And I think that's, again, kind of trying to empower people to do things in their homes as well, not be so service dependent maybe. But then also we've got It's Falls Prevention Week coming up soon. So a bit of a plug for that. And I think they're doing quite a lot of different things. It's a week of different activities. So I can share something around that. But I think there is a lot of work going on, but it's just how you link it all together. And I think, like we've said already, what matters to people and how you make it meaningful for them and something that they're empowered to go and take forward themselves rather than just giving out leaflets, because that's not particularly helpful. But
I'm not sure if there's anything else that anyone would want to share.
I was just looking at one of Kim's questions, if you had further ideas, anybody else. She's put there, what are the top tips for engaging people while social distancing is in place?
So from a Healthwatch perspective, obviously we're not normally used to being out and about and engaging with people on a face-to-face basis. So COVID, we've done it in a variety of ways. Obviously, we've done it online, but that potentially excludes people from people who might be digitally excluded. So we've linked in strongly with our third sector organisations as well. So that could be a potential strong theme for local care partnerships, to hear that voice, isn't it? To really link in with third sector community organisations to hear how it is. I think that's sort of I think that's part of hopefully the support that we can offer from the advisory roles on local care partnerships, to think about actually how do you hear those voices during COVID. And sometimes there's really simple things, aren't there? It's sort of, buddying up with local community organisations. It might be a refugee and asylum seeker organisation in your area, or it might be a carers group, and just having a cup of tea and just understanding what's going on for those communities. So it doesn't always have to be a full-scale survey and questionnaire piece of work. It can be as much as just stopping and listening to communities and community organisations that are working with those communities. But in terms of the top tips, we're keen from a People's Voices group to share some of that wider. So we'll definitely be sending that out to local care partnerships. And can I also say, we're really interested to hear the insight that you get from the people that you work with as well, and to feed that into decision making at a citywide level as well. So I think, did everyone, as part of this training program, there was a piece of work where people did go out and talk with their local communities, didn't they? And I don't know, was that written up into sort of a summary, or because it would be great if you were able to share that with us as well, and we can disseminate that through our channels as well. So I don't know who would be the best person to link into for that.
Yeah, I think it was depending on which group, PHM group it was. I don't think it was brought together as one piece of work.
Right. Okay. Well, maybe I'll contact the local care partnership team to sort of link into that.
I think it was Neil who was involved with ours on our LCP. The Morley chap you're talking about, Hannah.
Yeah, all of them really. Yeah.
So Neil was involved with that quite a bit, and there was data around that was brought together, and Health Watch were involved as well.
Oh yes, the sort of big local big leads chat we did in Morley. Yeah, of course, yeah.
So that data is there. So I think Abs, did we get it from Neil?
Yeah, I actually did share it with Morley Partners.
Yeah, all right. Sorry,
yeah, I think we've got that. I think particularly I'm thinking during COVID as well, and how people's experiences have changed during COVID.
Yeah.
I think that would be really interesting.
Actually, Abs, I've just remembered we did that survey, didn't we? There was an online survey, and we collated some results of that, so Hannah could have access to that.
Yeah, that was a different survey, I believe, to the big list chat they were talking about. But the big list chat, I think it was actually heard by Neil Sabas, right? Yeah. So Neil Maguire would be the contact.
Yeah. No, I was just thinking of when early on in the PHM, I think it was after workshop 1, was it, when people were asked to go back to the communities and talk to people about aging well and what it meant to them and about their local communities. But we'll look into that for you, Hannah, no problem. There's just another question that Kim had raised about when you've talked to people about the aging well model, what do older people think of it?
Ooh, is that a question for you, Hannah?
Possibly. Carol, do you have any opinions first? Because when I've done engagement with people, it's been more about the frailty work. But Carol, do you have any answers on that, or I could have a go?
I'm not sure I do, really, because I'm not one that, despite my job, I don't get out that often to talk to older people. It tends to be our colleagues at Leeds Older People Forum that are talking more with them about what's, so I think it's just the conversations about what's important to them, isn't it? And, I don't know if you can add on to, if you want to try and answer that one.
I'll just quickly say that when we've talked about frailty stuff and we've tried to do it quite broadly, it's evident how different what matters to them is, and it really does seem to be, you can't define it based on someone's age or ethnicity or where they live in the city, which kind of, I think, just reinforces the point that you do need to ask people when you're having those conversations and have meaningful conversations about what matters to them, rather than just trying to put a label on because somebody has been identified in a cohort, they're not all going to be the same.
Yeah, I definitely agree with that. Yeah.
Did someone else have their hand up? I think it's gone now.
I just quickly had it up. I can show you our Morley Population Management Survey response if you wish, if you want me to share it with you now.
Sure.
I don't know. I'll try. Let me see if I can do this. So these are some of the. I don't know if you can see that.
Yes, we can see that.
So what's important to the people that responded to us? Really useful stuff actually. Family, independence, and getting out. Big ones there. Looking at how that would be supported. Those are some of the things that we got from that. I don't know if that's reflected what was good about living here, what could be better. So there's quite a lot of things that, you know. So that was the examples that we got, and these are just some additional feedback questions we got as well. A lot of it, aging well, is about retaining that independence, that feeling, getting the adequate support, being able to. And family was a big factor in all of that. Some of the things that came out were things that have been withdrawn due to COVID. You know, there's a lot of things that haven't happened, but transport links, being able to get around, accessible healthcare. So that, I don't know if that was helpful.
Yeah, no,
I think it's really interesting as well, because some of those things like family or getting around might mean really different things to different people. So I think, again, that's interesting, the kind of what we mean by that and what that means to a person, and getting the balance of working for a community, but also working for people, which is difficult, obviously, but yeah.
I suppose just to share a piece of work that we're doing at the moment, and thank you very much for sharing that, but a piece of work that we're doing at the moment is really about hearing the voice of care home residents at the moment. And I suppose for me it really highlights that if you looked at it with a service lens, you'd think we were doing a good job, because you'd think we're keeping COVID out. That's the right thing to do. But actually, when you speak to people about what matters to them, it is connecting with their relatives. That's the fundamental requirement. That is what people live for in care homes, and so by not allowing visitors and connecting, and we're hearing of some care homes that are even banning window visits. So people haven't seen their relatives and for 6 months, we're actually not meeting people's needs. So from a health and care system, it looks like it's a tick, isn't it? Because we're keeping people COVID free, but from actually people's outcomes, we're not in every scenario. Some care homes are doing a really good job about sort of being dynamic risk assessments around it. But we are hearing some examples where people are saying to us they'd just rather die. They don't want to go on living. So I suppose for me, it just highlights the importance of focusing on person-centered outcomes rather than taking just a service lens to how we deliver health and care services.
That's a really good point, Hannah. And I came out of the Doing Stuff Better workshop, and we were talking about outcome measures, and there was a whole host of things that came out of that. EQ5D, the P3CEQ, and the PAMS. And we all seem to be using different outcome measures for trying to assess this, and that's the difficulty, is that person-centered. What is the actual, how do you do it? That's the hard bit, isn't it? Because a lot of people were scoring perhaps, or didn't understand that's what some of the people that have already done it in that workshop were saying. So
yeah.
if you've got any better ideas, that would be really helpful.
Yeah, I mean, I think there was work, wasn't there, before COVID around developing the frailty outcomes, which were based on what was important to people. But that piece of work sort of stopped with COVID, I think, in terms of those wider outcomes that we wanted to develop in terms of the CCG leading on that piece of work. But I think it is. Yeah, I think we would want. I think it's a mix of qualitative and quantitative, isn't it? And we're very much. Our message is we shouldn't be measuring success on levels of activity. We should be measuring success on those outcomes for people. But how you do that, I think we need to work together to find a way to do that, don't we? Tony?
Yeah, I was just going to say, kind of agreeing with you, Hannah. I mean, I'm going to use the phrase post-COVID, which is quite a difficult phrase to use at the moment, I guess, isn't it? But certainly, I know with prior to COVID and when the enhanced care homes was part of the PCN DES, in terms of adult social care and kind of our third sector partners as well, looking forward, we'd had hoped to start quite a lot of work really about how care homes kind of open up more in their local communities. I mean, we do hear, don't we, that the maybe 2 or 3 care homes that open their doors to the communities, and they have fish and chip evenings and things like that, and they kind of utilize their communal spaces, don't they? So that there is some connectivity between the home and and the community, and that's really valuable, isn't it? As you say, Hannah, in terms of relationships for the people who are in care homes who maybe don't have family members. To have that engagement. But unfortunately, I think we've kind of, for circumstances have meant that we can't really pursue that at this moment in time. But certainly going forward, a lot of care homes have kind of activity coordinators, don't they? And I think one of the key things for them is not just to be doing a bingo session or kind of 40s music hour once a week, but actually thinking, how do we connect the care home, because residents have a lot to contribute to the communities, don't they? And we all know, don't we, that feeling that you're still contributing regardless of age is a massive thing, isn't it, in terms of people's self-value. So I know that's been paused, but certainly I'm sure we'll all be working together with our primary healthcare colleagues and third sector colleagues about how we do get care homes more connected when circumstances allow us to do so.
Yeah, and I think for us, it's I feel like we should be ambitious around supporting care homes to be positive places to live despite COVID. And care homes are often forgotten. They're a forgotten bit of the health and care system. And I think it's a good judge of us as a health and care system about how we do enable some of our most vulnerable residents in our communities to live a positive life during winter. I think I sort of and there is lots of I just think it's something we should have all on our radar about enabling people within care homes to have a positive life at the moment, and connecting with their relatives is as essential as food. For it's as important as that. It's not just a nice to. It's as important as that. We're really keen that we really think seriously as a city how we do that.
Hannah, I was just going to share a bit of my experience. I did some strengths-based training around some needs care homes a couple of years ago, and I was quite shocked at how cut off from the communities the care homes were. They often didn't have any connection with anything, and it was almost living in the care home was like living in a prison, really. There was no connection with the outside world, and there was a very institutionalized attitude from the staff as well, because that's how it had always been. And yes, there is some really good stuff starting. I really hope that will continue, where links have been made with local schools and so on, doing intergenerational work. But maybe as well, the neighbourhood networks and the care homes could link up much more, because often the care homes have some great spaces that can be offered to organisations free of charge to run all sorts of different groups and so on. And that would really bring those people in the care home into their community. So I do hope that is possible at some time in the future.
Yeah, I think that's what Tony was sort of mentioning, wasn't it, around that and someone described to me, we think of care homes a bit like an institution, don't we? But they're someone's home, aren't they? They just happen to be, or next to each other, and they get a sort of a, they're supported in a different way. But those are people's homes, and they're all people part of a community, aren't they? So, yeah, no, absolutely. We see it as a big part of our work to keep shining that spotlight on people living within care homes at the moment. So they're not forgotten during this winter, and I'm sure they won't be. But it is really important that we think about it in those terms. Is there anything else, Francis? I don't know. What is your role, Francis? I'm a
GP.
You're a GP.
Yeah, I'm a GP. Yes, and I'm the one of the 2 PCN clinical directors in Wetherby as well. So yeah. I was just interested in Saab. When did you do the that questionnaire you'd done for as part of your population health management work? When did you? That wasn't part of the Big Leads chat, was it, or was that something separate you did?
No, it was part of the population health management. So we did it. I can't remember the timing now, but the date on it was a while ago, and it was trying to get the flavour of where we should, which direction where we want to go down, and what was important. And that was all about communicating with our community, rather than pulling data out of computers. You know what I mean? And we also used the chat as well. We used the Morley chat stuff as well, because that was, and it just reinforced all of that. It started to build a better picture. And I think we've still got a long way to go yet to get a real reflection of that. I mean, I know there's going to be clinical parameters as well that we need to measure, and I think it's all this measuring the right outcomes for the right things. And you're right, I think there's quantitative and there's qualitative, and both are equally as important. So I think that's how we approached it.
Was it did you wander around the streets, or was it a kind of a filling in form type thing, or was it?
Yeah, I'm always wandering around the streets, Francis. No, it was practice based. We encouraged all practices to do that, trying to engage them at one level. But we also, with the local chat, as in the Leeds Big Chat, was that we went out on the streets and collared people as they were going down the precinct, and seeing some familiar faces looking very embarrassed when they were walking with a can of beer at 11 o'clock in the morning, which I thought was just great.
I have told you not to do that, Sab.
Yeah, I know. But yeah, it was really good way of communicating. Leeds Health Watch really good as well, because they were involved. It was multidisciplinary, multifaceted. Lots of people from different. It was good. It was
good.
Yeah, we should do that again. Actually, I think.
Yeah.
Francis, I was just going to say we did something similar in Wetherby, as I say, after workshop 1 on PHM. Martin Lee had a member of staff who was shielding, and he rang lots and lots of people in Wetherby and the surrounding villages and asked those questions about what does aging well mean to you. So we have got that somewhere. I'll dig it out and send it to you.
Thank you. Yeah.
No problem.
I should say as well, I do chair a group called the People's Voices Group, and the aim of that is to work together to hear people's experiences and voices, and work as one health and care sort of listening team. But we have got an ambition to start to have like an intelligence hub in Leeds. So if you've got a question about what are people saying about being a carer in Leeds, then you'll be able to sort of access. Get some of that insight. So we're not there yet, but all this sort of local insight, it'd be great to sort of link it in as well, because what we're conscious of is we don't want to keep asking people the same questions if we've got that intelligence. So we're seeing people intelligence as important as the data stuff. So yeah, if you can share that information, that would be great. I think we're allowed. I think it was until 12:15, wasn't it? I'm just wondering if there's anything else that people would want to share. I mean, I found it really, really useful. Thank you so much for sharing everything with me. And and as I say, we'll look forward to supporting all the work that you're doing. We really want to support everything that you're doing around putting people's voices into your work. So, Hannah and Carol, is there anything else you'd like to say?
I mean, you've talked a bit about there is offers out there of services and everything to get people active, but do everyone know about them? Is there a way of communicating information out to everybody, or can we help in any way to share what we know? Because we'd be happy to do that, through Hannah. Yeah, so that's one thing. And also the Centre for Ageing Better have done quite a lot of research, some of which has been in Leeds. And one study they have done is they were going to do a full evaluation of our neighbourhood networks, and then then COVID happened. So that was changed slightly to do an evaluation about how the neighbourhood networks responded to COVID and how they dealt with it. So that's a report if anyone's interested in looking at. We can share all those links to the various reports and insights that's going on. So yeah, so just to say, yeah, there is loads of information out there. It's just making sure people get access to it. Do you want to add anything, Hannah?
No, just echoing that, just the offer of, yeah, there's a lot of information and it's not always clear who doesn't know it and where to go.
I think especially in a city the size of Leeds, it is hard to know everything, and you don't know what you don't know, do you? There is a lot happening, yeah, and different things maybe in different areas. So yeah.
Great. Is there anything else from anybody else on the call? Anything anybody's not said or contributed? No. I think it's back to the main hall for 15:15, isn't it? But thank you very much for everyone joining, and really nice to meet everybody and see people as well.
Thank you very much.
Okay, thank you.
Thanks. Bye.
Thanks, Hannah. Bye.